Well, did you know May is Stroke Awareness Month? And also, did you know that heart disease and stroke are the #1 and #3 cause of death in Texas? Together, they account for nearly 3 out of every 10 deaths in the state. Well, we have a very special guest to join us in the conversation to talk more about this and prevention. Doctor, introduce yourself to everybody.
Thanks so much for having me, Dr. Omar Tanwir. I'm the Director of Cerebrovascular Neurosurgery at Baylor St. Luke's. And we're here to talk about a very important topic that you mentioned not only is one of the leading causes of death, but actually one of the leading causes of disability, which for some people it can be worse than death. The burden of disability is quite a lot. So thanks for hosting us. And
oh yes, I think it affects more people than we realize, and it's so important to shed light on this. First of all, tell us, what are some signs that we may be on the lookout for if we are having a stroke or a loved one is having one?
Yeah, so it's important to know that technically anyone can have a stroke. Okay. Pediatric range to elderly range, it is something that is defined by a disruption to the blood flow to your brain. Very often it's a blockage that either came from somewhere else in the body or is in the brain itself. The signs and symptoms are extremely critical to identify because time is everything when it comes to stroke.
Great.
There's a great mnemonic that we try to educate people on called B FAST. B for balance, so if you're having balance issues. E for eyes, in case you're having blurry vision or blindness.
Okay.
That could be a sign of stroke. And then FAST would be face, your face is drooping, arms numbness and tingling. And S would be for speech.
Okay.
And then T is for time, because time is so important.
Now, is it primarily on the left side of your body? That's what I've always been told.
Well, left side actually, it can affect both sides.
Okay.
Yeah, and sometimes, you know, the brain works in the way that a stroke on the right side of your brain controls the left side of the body, and the stroke on the left side of your brain will control the right side of your body. So that's how we can kind of sometimes examine a patient and be like, you know what, that part of your brain is not acting right, let's do something about it.
So let's say we're having these symptoms or we notice something's off with a loved one, like my parents. What do we do? Because you say time is of the essence.
Yes, so once you identify that something is going on, even if you're not confident, you just have a concern, anything like that, it's really important to just notify the 911. An ambulance will come, bring you to hopefully a comprehensive stroke center. We're very fortunate in Houston, we have a lot of them, including our center. And from there, there's a whole slew of other treatments that can be pursued in a very timely fashion. Yeah.
Now, what can we do as far as prevention goes?
Prevention is the best. I kind of wish we have all a lot more focus on preventing something rather than fixing something.
Exactly.
So it's very important to talk to your own doctor, especially if you have high blood pressure. That's usually #1 on the list of things that can cause a stroke. So if you can control your blood pressure, that will help prevent strokes. Diabetes, high cholesterol, obesity, cigarette smoking, alcohol use. All those things are very common, and they're all associated with stroke. So the best way would be to modify those risk factors. Now, they can also run if you have a family history of stroke. It can happen to you because you have a family history. Obviously, we can't do anything about our family history, but those are the modifiable risks.
Now, I have a little one. You said pediatric strokes. I wasn't familiar with that.
Yeah, I spent a decent time at Texas Children's Hospital as well to do specific vascular procedures. And often the strokes that happen in pediatrics aren't your typical smoking, high blood pressure
right,
type
exactly.
of strokes, hopefully not. But it's actually from congenital issues, sometimes heart-related, where clots form in the heart and then go to the brain. Sometimes kids are born with very fragile blood vessels, so they can kind of block on their own. So the pediatric stroke, luckily, although rare, is something we deal with a handful of times a year.
So since it is Stroke Awareness Month, what is the biggest piece of advice and call to action we can do right now, would you say, Doctor?
Yeah, I think raising awareness is so important because the symptoms of stroke are so vast. It can be literally something from just feeling off balance to being completely paralyzed on one side. And so once you're aware of it, coming to the hospital as quick as possible would be the best thing that's going to kind of save you. Once you're in the hospital, we've got medications that we can give through an IV where it breaks up the clot. Those work a pretty significant amount of time, and that can be very life-saving. In Houston, we're very lucky we have a stroke mobile unit too, where an ambulance that actually has a CAT scan in it and the medication roams around, and if it picks you up and gets a CAT scan, in the ambulance, they can actually give you the medication there too. That's not something that's available all throughout the country. Houston's very special in the sense we have that, and we work very closely with them to make sure that they feel well supported and they have the support to do that. And then there are actual procedures where often I'll have to poke a needle from the groin, go up to the brain, and actually remove the blockage myself because the medication just didn't dissolve the blockage.
Well, doctor, if we feel kind of like we need to see you, what's the best way to reach out to you?
Well, for elective things, office and stuff, you know, they can reach out to our office and make an appointment if they're worried about that they have previous stroke symptoms and they're worried about what to do to prevent it, or there are other things that can be fixed. However, though, most of the stroke patients I see are emergent. They could be at 2 o'clock in the morning, middle of the night, wherever it is. My whole team, we take call and take turns of who's available 24/7. And once you're called in, you rush in, and that's when you see the patient.
Okay.
Unfortunately, we're seeing patients and their families usually at the worst time of their lives usually, but that's something that our center does a really good job of getting people through the worst times to a great recovery, and hopefully something that they forget about in the future.
Well, thank you for the work that you're doing and for raising awareness, and also we can take action now and change our lifestyle too. So I really appreciate your time today. Thank you.
My pleasure. Thank you for having us.